Here's a development that's sending shockwaves through the medical community. The nation's most influential vaccine advisory panel is about to welcome 5 new members who have a track record of questioning the very science they're supposed to uphold. This Monday, both the Centers for Disease Control and Prevention and the Department of Health and Human Services made an announcement that has health experts deeply concerned. The Advisory Committee on Immunization Practices, the group that essentially determines which vaccines Americans receive, is adding advisors whose qualifications raise serious eyebrows. But here's where it gets controversial. Several of these incoming committee members have spent years actively undermining confidence in vaccines, particularly those developed for COVID-19. Some possess minimal documented expertise in vaccination science, while others have built reputations by promoting views that contradict established medical consensus. This strategic reshuffling comes at a particularly troubling time. Senior health officials have been stepping down, citing frustration over being sidelined or coerced into supporting unscientific policies. These departures specifically relate to modifications in COVID vaccine accessibility and eligibility criteria. Tara Smith, who teaches epidemiology at Kent State University's College of Public Health, didn't mince words about the selections. According to her analysis, these individuals appear to have earned their spots not through demonstrated vaccination expertise, but rather through their vocal criticism of vaccines, especially COVID shots. She expressed particular worry that they might leverage their new positions to create additional barriers to vaccine access, especially given what's outlined in the committee's upcoming agenda. Jessica Steyer, a public health scientist who founded Unbiased Science, highlighted an even more concerning pattern. She emphasized that the real issue isn't about individual appointees, but rather the systematic displacement of seasoned vaccine specialists with individuals who have publicly challenged well-established vaccine science. And this is the part most people miss. The timing couldn't be worse for public health. Right now, measles outbreaks are actively occurring across the country. We're approaching respiratory virus season. When policy decisions get based on misinterpreted data, the consequences aren't theoretical. They're immediate and affect real families. Even if these committee votes ultimately favor vaccines, the public spectacle of vaccine skepticism and anti-vaccine messaging is causing substantial harm to public confidence. This Thursday and Friday, the Advisory Committee on Immunization Practices faces 3 critical votes. They'll decide on recommendations for the combined measles, mumps, rubella, and chickenpox vaccine, the hepatitis B shot administered to newborns, and COVID vaccines. Here's what's at stake that many parents don't realize. These upcoming votes could threaten. This seemingly small change could have enormous consequences. Hepatitis B infections among young people have plummeted by 99%, but delaying vaccination could allow this dangerous virus to regain a foothold in America. The committee also appears poised to further restrict COVID vaccine recommendations. Steyer warned about another troubling tactic she expects: presenting unverified reports from the vaccine adverse event reporting system as if they represent confirmed vaccine-related deaths. She compared this approach to treating every emergency call as definitive proof that a crime occurred, a fundamentally flawed interpretation of preliminary data. So who exactly are these new advisors, and what do their backgrounds tell us? Catherine Stein serves as a professor in Case Western Reserve University's School of Medicine, specifically in the Department of Population and Quantitative Health Sciences. However, her approach to public health has raised eyebrows. In January 2021, she wrote that Jesus Christ didn't fear lepers despite leprosy being highly contagious, and that he healed and touched them without social distancing. She used this religious argument to justify rejecting COVID precautions. Stein has argued that face masks serve primarily as symbols of fear while actually harming wearers' health, a claim contradicted by scientific evidence. She stated that Christians shouldn't fear death and characterized COVID-19 as not being the dangerous threat portrayed by media and government, even during periods of high mortality. During her personal time, Stein has conducted research for Health Freedom Ohio, an anti-vaccine organization with ties to Children's Health Defense. This group was previously led by Robert F. Kennedy Jr., who now heads the Department of Health and Human Services. In February 2020, she added her signature to correspondence urging then-President Trump to reconsider school and daycare vaccination requirements, focusing on stopping what she termed the persecution of unvaccinated people of faith. Kirk Milhoan practices as a pediatric cardiologist and has campaigned against COVID vaccines due to the extremely rare risk of myocarditis, heart muscle inflammation. He's Evelyn Griffin, transitioned from practicing as an obstetrician and gynecologist to focusing on holistic health approaches. At a Louisiana Health Freedom event in May 2024, she suggested that vaccines pose safety risks. She criticized fellow physicians for blindly trusting COVID vaccine safety and revealed that medical school taught her childhood vaccines were harmless, requiring students to simply memorize vaccination schedules. Griffin has participated in Stop Vax Passports webinars, discussing her experiences treating women following COVID vaccination and her efforts to prevent vaccine mandates for Louisiana children. Hillary Blackburn, who is Senator Marsha Blackburn's daughter-in-law, works as a pharmacist and has recently proposed connections between vaccines and autoimmune disorders. Raymond Pollock practices as a transplant surgeon. These 5 new advisors will join 8 others selected by Kennedy this past June. This followed his unprecedented decision to dismiss all 17 previous advisors, a move without historical precedent. The Evidence Collective has documented over 50 false statements made during the reformed ACIP group's initial meeting. The Vaccine Advisory Committee can include up to 19 members, meaning 6 positions remain unfilled. Typically, the vetting and training process for new committee members requires months or even years to complete properly. But here's the question that's dividing experts and parents alike. Should vaccine policy be influenced by religious beliefs, alternative medicine practices, and skepticism of established science, or should it remain firmly grounded in peer-reviewed research and clinical evidence? What do you think? Are these appointments a necessary course correction that brings diverse perspectives to vaccine policy? Or do they represent a dangerous departure from evidence-based medicine that could put public health at risk? The stakes couldn't be higher, and the medical community is watching closely to see how this unprecedented experiment in vaccine governance unfolds.